let's discuss this, and I actually have made a concept map for you for CAUTI prevention, and I'm thinking that you know what CAUTI means, right? C-A-U-T-I, it's a UTI, and that is catheter associated urinary tract infection. That's what CAUTI stands for, right? Catheter associated urinary tract infection. So basically most probably it's going to be like the Foley catheter and things when they have it, and you know, how can we prevent it. So I made this concept map for you to kind of see what are the major points you should remember whenever you get a question about anything related to this UTI prevention. Okay, it's about the catheter we are talking more, but anything related to UTI prevention, this will be something you will have to look for. And this is a question in risk reduction, right? So first of all, I bet everybody agree with me about hand hygiene. Like, hand hygiene has to be done by the nurses and the nursing assistants and anybody who is going to take care of the patient. We should adhere with the hand hygiene principles, and you guys know when to wash and how to wash and all those things. So we are not going to go into details on that. We did that in infection control session. But remember to do the hand hygiene, and not only the healthcare professionals but also the client. Because if the client is not really doing the hand washing, there is possibility that it's going to get contaminated, right? So hand hygiene is one. Routine perineal care. But regarding routine perineal care, do we have to use antiseptic solution? And the answer is no. There is no need for using antiseptic solution for routine perineal care. Perineal care is good. It has to be done especially after each bowel movement, because we know what is the most common, one of the most common bacteria which causes UTI is E. coli, right? And E. coli is something which might be coming from a contamination with bowel movement, because you know, from the intestine through the stool, it might be coming out, and then it gets its port of entry into the urinary tract, you know, because the catheter is there or it was contaminated. So it's very easy to get that port of entry and create a UTI. So perineal care after each bowel movement, really good option. But we just need to use soap and water, right? We don't need to use a antiseptic solution, and that may not be ideal, because especially if there is something which has some, you know, alcohol base in it, it's going to dry up the genital area, the perineal area. It's going to cause more problems. So just soap and water, proper perineal care would be enough to prevent it. So that's routine perineal care is good. Catheter bag below bladder level. So that's another thing we say whenever we are, giving them the perineal care, or whenever we are transporting the patient, or even if the patient is sitting on the chair, or maybe they are on the bed, we always make sure that the catheter bag, the drainage bag, is kind of below, the bladder level, because we don't want it to go up and then there may be backflow and the urine might get back into the urinary bladder and then cause problem. Okay. Now the other one is drainage system should be off floor. Do not keep it on the floor. For example, like this, right? This is not touching the floor. Even if the floor is really clean and all good, but still this bag, this is the drainage bag, right? The Foley catheter drainage system. This should not be touching the floor. And also we have to kind of take care of that, cleaning the floor. You know, the floor should be really clean. Ensure that there are clean floors. Most of the time there is housekeeping doing their routine thorough cleaning on the floor, so that's going to help. And whenever we have to do some kind of measurement, or maybe the drainage bag is full and now we have to measure how much urine is there, or maybe we have to empty the drainage bag. So one of the major things we need to make sure is that we are using some clean containers to empty from the drainage bag. I mean, when we are emptying it from here, like, most probably this part you are going to take it and then keep it into a container, and then you're going to empty everything. And at that time, there is a chance that this is going to touch that container. Okay, I mean, it could be possibility is there, and we don't want any kind of dirty containers for that. So every time we empty the urine from the drainage bag, whatever container you're using to throw it out into the, into the toilet or wherever you have to discard that, we have to make sure that we are using a clean container every time. Make sure that it's clean, right? We don't want anything going back into the patient. And the other one is sterile technique. Anytime we are taking a specimen from the catheter, we have to be extremely careful not to introduce any kind of bacteria into the system. We know how much care we take when we are actually inserting the Foley catheter or the urinary catheter. We are so careful not to break the sterile field. So that kind of sterility should be there anytime we introduce something into the system. So for example, if we need to take some specimen, urine specimen from the catheter, be very careful not to introduce any kind of bacteria, right? So sterile technique. Then prevent pooling of urine in the tube. Pooling of urine meaning like whenever the tube is there, make sure that it's draining properly. So don't let that urine just sit there on the tube and then stay there and then accidentally go back to the patient's bladder. We don't want that. So always make sure that it's a check the system to make sure that the urine is draining okay. It's continuously coming out. Check for clamping or kinking or making sure that the connections are secure, like they are not leaking anywhere. I mean, sometimes we may have to clamp the tube. I mean, maybe we need a specimen or maybe there is some doctor's order and we need to clamp the tube. That's okay, but we cannot just leave it clamped for a long time, right? Because the patient is not having any other way to get the urine out. So first of all, we are going to watch for urinary retention and we are going to palpate the bladder and make sure that it's not kind of getting distended. So if the doctor is asking for you to clamp, most of the time there is going to be some kind of parameter with it, like clamp for this many hours or clamp and check back or whatever it is. So make sure that it's not getting clamped for a long time. It's going to create reflex of urine into the patient's ureter and kidney and damage, and that's not okay. Also making sure that everything is secure, it's not leaking, there is no entry for any pathogens. Prevent dehydration. So when someone is having a urinary catheter, of course we can measure what is the output which is coming, but it's also very important that we keep the patient adequately hydrated. So we have to make sure that the patient is getting encouraged intake of oral fluids, if that's okay. I mean, if somebody is NPO or if they have a swallowing problem, then of course we will go for IV or whatever is needed to prevent dehydration. But it's very important that the patient gets enough fluid, right? Because we always say that flush the kidneys, right? We don't want anything to stay. There should be enough fluids coming out. And secure the catheter with Velcro or as per policy. So I want to show you that this is the Velcro system. I mean, there is different kinds, okay, variety of things available, which is to be together. We can say, generally we can say, like, just secure the catheter so that it doesn't get pulled or accidentally come off or things like that. So we can always keep it kind of secure to the patient's leg. So it's just kind of a belt kind of thing to keep it there. And there are other kind of things available too, something which is like a sticky thing, like a stat lock or anything like that, just to secure the catheter. And that's a good thing because that's going to prevent that pulling and pushing and getting it out accidentally or movements and discomfort. And of course, we don't want any lacerations or any tear happening. So this is going to be a good thing. And it's according to the institution policy. And most of the time, this Velcro itself is a good thing to do, right? So that's some stuff I wanted to put it together. So when you look at this, like when you look at like CAUTI prevention and you have this one slide with you or just one note with you, this is going to cover everything. That is the beauty of concept maps. I mean, it takes time to prepare them, but this is how we do the RUP review, the final review, where you're like, okay, let me look, okay, this one, right? So it's going to be so easy for you. Okay, so now let's go back to our question, and I'm sure that you will have some of the answers. Probably you have changed now, but I just wanted to give you the answer here. Do we need to irrigate the catheter daily? Do we irrigate a Foley catheter which is there? There is no need, right? As long as it is working, it is draining, we are okay with that. We will check to see if there is a continuous flow, or we will measure the output and see if it is working properly, and we will ask the patient if they are having any burning pain or if they have any fever. You know, we are kind of monitoring for any kind of infections, so that's going to be very, very important. But there is no need to irrigate the catheter daily, right? That's not needed. Instead, what we should be doing is encourage more oral fluid intake or IV intake, or if it is that is what needed, because we need to prevent dehydration. That's more important. So is 1 going to be our answer? And I would say no, because we are looking for something we should do, and there is no need for irrigating. Okay, all right. So the next one, the question, I mean the option, I'm sure you know why it is not our answer, because performing perineal care is good, but we don't need any antiseptic solution. So soap and water and hand hygiene is going to be more important there, right? So 2 is not our answer. And third one, place the catheter drainage bag on the clean floor. No, we don't want it to touch the floor. Right? It doesn't matter. I mean, it should be clean floor anyway, but even if it is a clean floor, we don't want the drainage bag to be on the floor. It should be above, off the floor. It should not touch the floor. So 1 is not our answer, 2 is not our answer, 3 is not our answer. The only 2 answers which we have here is 4 and 5. Attach the catheter tubing to the client's leg using Velcro strap. Good. It's secure it. Securing it is a good thing. Use sterile technique when collecting specimen from catheter. Of course. It's a big of course. You should do that. So we have only 2 answers here, 4 and 5. Are we good with that? You got it? Right? Is everybody agree with that? So just for your notes, I'm just going to show you this. I'm hoping that this is going to be very helpful for you. And even though we just discussed 1 question, when it comes to concept map like this, we are actually discussing probably like 6 plus 5, almost like 11 questions. It's equal to discussing 11 questions, because each point is important, right? So that's the beauty. So I'm hoping that it is clear to everybody, and I'm hoping that you will remember to make your own concept map whenever you are learning something or when you're reviewing. Okay, are we good?